Navigating the labyrinth of adult ADHD diagnosis in the UK, a tale of two journeys. Across the UK, countless individuals walk a similar yet distinct path towards an adult ADHD diagnosis. Navigating the healthcare system can feel like a labyrinth, filled with varying options, challenges, and ultimately, the hope for clarity and support. While the broad strokes of this journey are shared, let's delve into the intricacies and explore the nuances that mark the experiences of those seeking an ADHD diagnosis in England and Scotland. England, a balancing act between the NHS and private care. For many in England, the initial step involves traversing the NHS landscape. Here, the right to choose pathway offers some flexibility, allowing individuals to select a private provider within the NHS framework. However, accessing this pathway can be riddled with complexities, often requiring careful navigation of eligibility criteria and potential bureaucratic delays. The wait for an NHS assessment can stretch for months, even years, leaving individuals in a frustrating limbo. For those who cannot or choose not to wait, the private sector beckons. Yet, this comes at a significant cost, with assessments exceeding £500 and medication and therapy adding further financial strain. This stark choice between waiting and paying can feel like a cruel balancing act, forcing individuals to prioritize their mental health while potentially jeopardizing their financial stability. Scotland, navigating a different path within the NHS. North of the border, the journey diverges. The right to choose pathway is absent, making the NHS the sole provider for adult ADHD services. This often translates into lengthier wait times, with assessments sometimes taking years to materialize. The frustration for individuals can be immense, with the system seemingly prioritizing patients over timely access to essential health care. While private care remains an option, the financial reality remains unchanged. The substantial costs can create an impassable barrier for many, exacerbating existing inequalities and forcing individuals to choose between prioritizing their health and financial security. Convergence in struggle, divergence in solutions. Despite the geographical divide, the stories of struggle and frustration often converge. Individuals in both England and Scotland confront the complexities of a system ill-equipped to handle the complexities of adult ADHD. The impact on mental health is undeniable, with self-doubt, anxiety, and financial worries becoming unwelcome companions on the journey. However, the path towards solutions also diverges. England's focus may lie in streamlining the right to choose pathway and expanding access to specialist care within the NHS. Meanwhile, Scotland's challenge rests in bolstering its current system, increasing resources and training for ADHD management, and exploring alternative funding models to ease the burden of private care. A call for a common vision. Ultimately, regardless of which path unfolds, the destination needs to be the same: a healthcare system that is accessible, equitable, and responsive to the needs of individuals with ADHD. This requires a unified vision, one that transcends geographical boundaries and acknowledges the shared struggles and unique needs within each region. Whether navigating the intricacies of the right to choose pathway in England or facing the long queues within the Scottish NHS, every individual deserves to reach the end of their journey with a diagnosis, not a mountain of debt or years of wasted time. It's time we dismantle the labyrinths and pave a clearer path towards understanding, support, and ultimately, a better future for all those battling the invisible struggle of ADHD.